Can a pregnancy test predict testicular cancer? A social media post about a man's positive pregnancy test reportedly led to his testicular cancer diagnosis. The man jokingly took the test, which an ex-girlfriend had left behind in his medicine cabinet. He shared the surprising positive result with a friend, who shared the news on social media, carefully shielding the test taker's name to protect his privacy. The post quickly went viral and drew more than 1,600 comments. If this is true, you should check yourself for testicular cancer. Seriously. Google it. A trip to the doctor revealed the male pregnancy test taker did, in fact, have testicular cancer. Pregnancy tests work by detecting human chorionic gonadotropin, HCG, a hormone in the blood and urine produced by the developing placenta. It turns out that some types of testicular cancer make the same hormone. So, is it worth running? Out to buy a pregnancy test to check for testicular cancer? There's no advantage to relying on a pregnancy test to self-diagnose testicular cancer. It's even dangerous to do so, says urologist Christopher Wood, MD. Some forms of testicular cancer cause elevated HCG levels, but others don't. Someone could get false reassurance from a negative test, or could have elevated HCG levels for another reason altogether. Instead, Wood says men should see a doctor if they notice testicular cancer symptoms or unusual changes, including a lump or enlargement in either testicle, a sensation of heaviness in the scrotum, or a sharp pain or discomfort in the scrotum or testicle. He recommends performing a self-exam in the shower once a month, starting in puberty. Testicular cancer manifests itself most commonly as a painless scrotal mass, Wood says, so check yourself, know your body, and see a doctor if you detect anything suspicious. Compared to other types of cancer, testicular cancer is rare, accounting for just 1% of all cancers that occur in men. Yet it's the most common cancer in males ages 15 to 35. This is a disease of the young, Wood explains. The typical patient is in his 20s or 30s, though we've seen patients as young as 15 and as old as 55. The disease occurs when cells in the testicles grow and multiply out of control, causing tissue damage and disrupting the normal function of the testicle. The exact causes of testicular cancer are unknown, but a number of factors have been identified that increase a man's risk of developing the disease, including undescended testicles at birth, a family history of testicular cancer, or a previous testicular cancer diagnosis. Testicular cancer is highly treatable even when cancer has spread beyond the testicle. While a cancer diagnosis is always serious, Wood says, the good news about testicular cancer is that the vast majority of cases, even if they're caught further along, are still very curable. So let's say it's not 100% reliable, but it's worth trying. Well, who would have thought that a pregnancy test might save a man's life? Thanks for watching, stay safe, and see you in the next video.